Hello everyone, this is Dr. Katmaksi from Valdosta State University. I'm an assistant professor at the counselor education program, and today I'm going to provide you information about our program. So in our counselor education program, we have two tracks. Our first track is school counseling track, and our second track is clinical mental health counseling track. So the school counseling track prepares individuals to become professional school counselors and certified school counselors in the state of Georgia. So the clinical mental health counseling track prepares individuals to become clinical mental health counselors and prepares also individuals to become licensed professional counselor in the state of Georgia. And clinical mental health counselors work in different settings, and we're going to take a look at that in a second. So if we take a look at our structure, our counselor education program structure. So there are some classes only school counselors, only students from school counseling track takes, and there are also some classes only clinical mental health counseling students takes. But also there are some classes that both school counseling and clinical mental health counseling students take together. So 6 classes, specialty courses where only school counseling students receives, and then 6 also for only clinical mental health counseling students take. And there are 10 classes students from both tracks take these classes together. So in addition to these classes, students also receive practicum, internship 1 and internship 2. And during these practicum and internship classes, students spend a lot of time in their site, and then so that they can sort of like practice and then experience as a counselor day-to-day function, and come back to the class and then receive supervision about their experiences. So professional school counselors, they work in elementary, middle, and high school settings. And oftentimes school counselors work with students, but also they work with parents, teachers, and other stakeholders at the school, and also other partners in the community, so that they can provide most effective services to their students. Obviously, this is just an overall information about the functions of the counselors, but when you enroll to the program, you are going to take many classes that would provide so much depth information about the functions of a counselor. In professional school counseling work, there are some strategies and techniques that school counselors use to reach students. So the first technique is called individual sessions. So this is basically a school counselor spend time with a student or with a parent, where they discuss some of the challenges that they're experiencing, or some of the ways that they can function better in their academic, social, emotional, or in their career perspectives. So in small groups, school counselors reach students who have similar needs, and then they conduct maybe 6 or 7 sessions to overcome some of these challenges. So one example for that, for a small group counseling session, would be preparing improving students' study skills who are maybe like failing from classes. So the last strategy is classroom lessons. So this is very similar to a psychoeducational activity where school counselor teach a class to a class of students and provide information about a specific topic. School counselors also work with different partners from the community and other systems at the school. So one example for this one would be, sometimes school councils organize parents' nights or career events where they invite professionals from the community so that they can meet and provide information about their careers, and students can choose their career in a more sort of informed way. School counselors, so there are 3 domains that school counselors work mainly. So these includes academic, social, emotional, and career. So school counselors work with students to improve these 3 domains. And also school counselors study the data to identify what is not working at the school and identify the achievement gaps and advocate for systemic change. So this is an overall of professional school counselors' job. So the training, so the Georgia Professional Commission certifies school counselors. So one requirement to become a certified school counselor is to graduate from a counseling program where a national or regional accreditation from a regional, nation or national accreditation accredited institution of a higher education, including an internship. So our program, our school counselor program, is a CACREP accredited program, and our students spend 700 hours in the school environment. So they basically practice all the skills that they learn from classes. So they practice these skills at the school environment, and they work with site supervisors who can provide closer supervision when they're providing these services. We also try to make sure that our students spend at least 100 hours in each level. So this includes 100 hours in elementary schools, 100 hours in middle, and then 100 hours in high school, so that our students can get a better sort of like feeling about what population that they really want to work. And in addition to these requirements, so there is an assessment called GATE School Counseling Content Assessment 1 and Assessment 2. So students who graduate from our program also take these assessments to become a certified school counselors. And every class, so this should not be a, sort of like a worry for you at this moment, but every class you take in our program prepares you to pass these classes. And we have a very good rate of our students doing a great job of passing the GATE. So licensed professional counselor. So this is so LPC, licensed professional counselor. So the requirement for LPC is a master's degree in mental health services, trained to work with individual families and group in treating mental health, behavioral, and emotional problems and disorders. So this is this is now our second track, which is clinical mental health track. And students who graduate from our clinical mental health track are seeking to receive an LPC to become, to work at the to function as a counselor. So the practice clinical mental health counselor, so this is our second track. So the main practice is diagnosis and treatment of mental and emotional disorders. So these can include addictive disorders, psychoeducational techniques aimed to prevent such disorders, consultation to individuals, couples, families, and groups or organizations, research into more effective therapeutic treatment modalities. So these are some of the functions that clinical mental health counselors experience during their work. So where they really work, where we can see clinical mental health counselors. So as we stated at the beginning of our session, clinical mental health counselors work in different settings, and some of these settings include hospitals, inpatient or outpatient detoxification centers, mental health facilities or agencies, residential care facilities. So there are our educational systems, career centers, private practices, or at university, at university counseling centers. So so the areas that they can work is very, very different, and we can see counselors, clinical mental health counselors in these settings. So the requirements to become LPC, so this is the requirement licensure to work as a clinical mental health counselor or as licensed professional counselor. So the first requirement again is to graduate from a master's or a doctoral program in a national or regionally accredited institution. And this program should need to be included internship. And again, we in our program we have our students spend 700 hours in a site with actual clients to practice the skills that they learn. And then after these students graduate, they take national counselor examination or a similar state recognized exam. And after they pass this exam, so they need to complete a minimum of 3,000 hours after master's degrees provides clinical experiences, and this would be performed within 2 years. So the LPC, licensed professional counseling, so the licensure would take a little more time, but counselors or students who graduate from clinical mental health counseling track still can work as a counselor after they graduate their master's degree. So for our accreditation, our clinical mental health counseling is a CACRIP-like. We are going to apply for accreditation at the end of 2021, we are going to apply for our full accreditation in May 21. So the CACRIP-like means that everything that we have designed is meeting the CACRIP requirement, but we have not applied for CACRIP accreditation because our first cohort is graduating in May. So in order to apply for a program to become a CACRIP accreditation program, they need to graduate at least one cohort. So 600. So the total required credit for both tracks are 600 program hours. Classes are sequenced with a summer only start. So we only accept students in summer, and then 2 years to complete, including summer. So you're taking classes during the summer, but the program can finish in 2 years. And typically we have 20 or 25 students in our program. So the core classes that both students from clinical mental health counseling track and students from school counseling track takes together include orientation to counseling, research methodology, measurement and evaluation, counseling theory, counseling skills and techniques, group counseling, counseling culturally diverse populations, development psychology, career counseling, and ethics. And specialty courses for school counseling, psychopathology and diagnosis, ethics, counseling children and adolescents, comprehensive school counseling, principles of learning and classroom management, consultation and advocacy in schools, and also they have practicum and internship 1 and internship 2. So school counseling field experience. So again, so the first practicum is at 100 hours. So this is where students just start sort of like taking some school counseling roles at the school with the practicum. But internship 1 and internship 2, they spend a minimum of 300 hours at the school, and by the time in their internship 2, they function as almost like a full school counseling, full professional school counselors at the school. So for specialty classes for clinical mental health counseling includes psychopathology, diagnosis, counseling children and adolescents, ethics, clinical mental health counseling, assessment and counseling, issues in mental health counseling, and field experiences. And these experiences include practicum, internship 1 and internship 2. So the first experience is 20 hours. This is just an observation in part of a class. And then the second is practicum, where they spend about a minimum of 100 hours. And the practicum experience include observation, case management, and co-therapy. And internship 1 and internship 2, so these are 300 hours each. And at the end of the internship 2 is basically they are working as almost as full-time counselor at a site, and they're taking most of the roles that a counselor would take in their practice. So these are some of the functions that counselors, clinical mental health counselors or school counselors take in their role. So now we're going to talk about our admission requirements. So the first step is to complete VSU's graduate school application. So this is very simple. It is just an online form that you provide your information and then and complete this application. So the fee for the graduate school application is $45. So the official institution is official transcripts from your institutions. So bachelor's degree in any major. So any major can really apply for our programs, for our tracks. And the minimum requirement, GPA requirement, is 2.75. So we also have program admission assessment scores. So this, and then a goal statement and case studies. Yeah, we're going to talk about the program admission assessment score in a second. Goal statement and case studies. So you are going to you are going to receive a direction, a scenario, and then you're going to about a case, and then you are going to provide your perspective or your reflection about how you would handle that situation. And the last requirement is 3 letters from your 3 recommendation letters, and one of them needs to be from one of your professors. So let's take a look at this program admission assessment scores. So the program admission assessment scores. So if you have SAT 1000 or ACT 43 English plus math, so you can apply for an exemption. So if you meet these so if you have one of these scores, you can apply for an exemption, and you don't have to take take the program admission assessment. And the other one also is the GRE. So if you have a GRE score that is 297, you don't have to do. You're just going to apply for exemption, and then you would meet this requirement. So if you don't have one of these scores, you can. So you are required to take a GACE, program admission assessment, and this is just another assessment where you take and then provide the result. But I think the great news is that this requirement, the assessment requirements for due to COVID-19 are waived for summer 2021 admission cycle. But if you don't have one of these results, you will just need to take GACE for GACE assessment first, and then you would need to provide that with your other application documents. So there are some program assessments. So our first assessment is counselor preparation comprehensive exam. So students, this is after. So these are during your training, after you receive acceptance, or obviously you apply and then you receive acceptance from the program, and then these are the program assessments that you would require to take and pass. So one is our counselor preparation comprehensive exam. So this is the national comprehensive examination, and in our handbook we also detailed and provided a better information about if you have any specific questions. So the handbook really provides answers for that. So examination really measures CAC Group 8 core areas, so like a research or group counseling, and 6 other areas. So students need to pass in order to start their internship too. So this is really like the second year at the end of your first semester. So the other one is school counseling. So this is the certification requirement exam where students from school counseling tracks takes a GACE, school counseling content assessment 1 and 2. So certification examination. So this is an examination for the state, and in order to be certified, students need to pass this exam. For clinical mental health counseling track, we have national counselor exam or national clinical mental health counseling exam. So these are examination requirements to become LPC, which is licensed professional counselor. And during the program, we have key performance assessments where we provide assignments for our key performance assessment. Okay, so our application deadline is March 15, and I'm going to provide you some emails. If you have any questions, please feel free to email any of us, and we look forward to seeing you. So thank you so much for listening, and we really appreciate your time.